What is cranial trauma? A cranial trauma is an injury to your skull and brain. There are several different types of cranial traumas. Concussion. A concussion occurs when you suffer a blow to your head that's so severe your brain moves back and forth inside your skull. This rapid movement can cause bruising and bleeding in the brain, as well as changes to your brain cells. Skull fractures. There are several types of skull fractures, including linear, depressed, diastatic, and basilar. Depending on your fracture's location and severity, you might need surgical intervention to repair your skull, drain extra fluid, or remove shards of bone from your brain. Intracranial hematoma. A hematoma is a blood clot. You can develop hematomas in several locations in your brain. For example, an epidural hematoma forms between your skull and dura. A subdural hematoma forms between your dura and the brain, or you can get an intracerebral hematoma in or on your brain. What signs tell me to see a doctor about my head injury? Head injuries range in severity, but should always be taken seriously. You should make an appointment at Farin neurosurgery if you lost consciousness or have any signs of confusion or disorientation following a head injury. How do you evaluate cranial trauma? I provide exams to evaluate your cranial trauma. I reviews your symptoms and the details of your injury. I use X-rays, CT scans, MRIs, electroencephalograms, EEGs, and blood tests to examine your brain. How is cranial trauma treated? Treatment depends on the details of your head injury. For example, I might recommend ice, acetaminophen, and observation for mild cranial trauma. I might prescribe medication to prevent seizures or reduce fluid accumulation in your brain. I also offer expert brain surgery to repair skull fractures, remove hematomas, or relieve pressure on your skull. Recovering from a cranial trauma can take some time. Stay patient, attend your follow-up appointments, and stay with my advice to optimize your recovery. Thank you for listening.